Some of the imaging studies we perform entail the injection of contrast, and this can be a concern for some patients. When it comes to CAT scans, the contrast we inject is iodine-based and can be toxic to the kidneys if you have renal dysfunction. For a normal person with well-functioning kidneys, it's generally not a concern at all. That's why we check the renal function and take great care before we inject the contrast. The contrast used for MRI is a gadolinium-based substance that is not nephrotoxic, meaning not toxic to the kidneys. The only thing we have to be concerned about is if the kidneys are not functioning well, patients can't excrete it or get it out of the body well. So even in those cases, we usually keep an eye on the renal function to make sure they can tolerate it. But there are generally little to no side effects from the MRI contrast injection. The only other area of injection we do in radiology, at least in our imaging centers, is in nuclear medicine, where we frequently inject a radioactive substance into the vein and do some imaging either immediately after or several hours after. These radioactive substances have no side effects whatsoever, except for the fact that they are radioactive. But in terms of physical symptoms or things like that, patients should not have any side effects at all and should not be of any concern.